Thousands of flu samples sat in Seattle as researchers sought to test and flag them for the coronavirus, but the CDC wouldn't allow it. The Times notes that interviews and emails show researchers began performing coronavirus tests anyway, without government approval. And when results came back, they had a positive test from a local teenager with no recent travel history, the first case of community transmission in the region. As the Times puts it, the failure to tap into the flu study was just one in a series of missed chances by the federal government to ensure more widespread testing during the early days of the outbreak, when containment would have been easier. Instead, local officials across the country were left to work in the dark as the crisis grew undetected and exponentially. Let's bring in emergency physician and public health professor at George Washington University, Dr. Leana Wen. She previously served as Baltimore's health commissioner. Dr. Wen, great to have you back on the show. Any word on when there will be conclusive testing across the board so that the experts can get a handle on this crisis and work with real information to contain it?
Look, you're right, Mika. This has been a major misstep by the federal government. We are where we are now because we just don't know what the situation is. And the federal government has been promising that we're going to get these millions of tests. But I know that here in Maryland and all around the country that clinicians that want to test their patients and need to test their patients just don't have enough testing capacity. But we are where we are. And we have to move forward. And I agree with what Dr. Dave just said, that we have to take this extremely seriously. We're going to see many hundreds, if not thousands, of cases in the next coming weeks. And this is the time for us to prepare and to do everything we can in our daily lives, because our individual actions will make a big difference. And we have to guard for these disruptions as they happen. Schools are going to close, events are going to be canceled, and it will be hard for us. But we have to be ready for it because literally lives are going to be at stake here in this country, too.
Hey, Dr. Wen, it's Willie Geist. Let's talk specifically about what it means to be ready. The president said yesterday of coronavirus, it will go away, just stay calm. I assume you don't share that view of the approach to this virus. But, you know, we had two presidential candidates last night cancel big campaign events. We have a giant basketball tournament starting next week, the NCAA March Madness tournament, with stadiums and arenas full of people. Where do you think this is headed in the next week or 10 days? Are people going to stop going to events? Will more events be canceled? Will school be canceled? Should people stop going to work? Where are you on where this is headed right now?
Let's look at even where we were 2 weeks ago. 2 weeks ago, we had 15 cases that were diagnosed in the U.S. We now have over 1,000. And that number is going to escalate dramatically in the next 2 weeks. The responsible thing for us to do now is to cancel events. It's to practice the social distancing and do whatever we can, knowing that it's going to be hard. It'll be hard when schools get canceled. It'll be hard when all these large events get canceled with huge business consequences. But if we don't do that, what's going to happen is that we'll have so many cases come up at the same time that it will overwhelm our ability in hospitals to treat patients. And then patients with heart attacks and strokes and trauma are not going to get treated either, and people are going to die. So it's up to all of us to cancel events, not go to large crowded events ourselves, and really take this extremely seriously. Even if the federal government is putting out muddled messaging, we need to be doing the right thing for our communities.
Yeah, and the leadership seems to be coming from state governments, local governments, even schools, which are doing a good job trying to stay ahead of this. As you know, Dr. Wen, South Korea attacked this problem quickly. Hong Kong has done the same. China has done better in the last week. What can we learn from the experience of those nations as we try to address it here?
We can learn that it's not enough to be reacting to what's already happened. We have to anticipate what's going to happen and not be afraid to take aggressive early action. If we had done more in weeks before, we wouldn't be where we are now. Now, we have to look forward and we have to do more. But that's why we cannot be afraid. And it will be up to local and state governments. The CDC provides guidance, but ultimately a lot of decisions are made at the local level. And our local leaders have to be unafraid to tell the truth, to communicate honestly, and to do the right thing.
So, Dr. Leana Wen, I'm wondering, I still don't understand how hospitals figure into all of this, because it just appears from everything that we know, the science, that you don't want people with coronavirus in a hospital. So is there any move being made to put them somewhere where it can be contained? I don't know how you contain it in a hospital.
It's a really good question. And the advice and also what we've seen in other countries is that most people who get coronavirus, COVID-19, will have mild symptoms. 80% will have mild symptoms that do not require hospital care. Those people should recover at home and not even set foot in a hospital. And that's the so-called worried well, too. People who may not have coronavirus but are worried about it. The key is don't go to the ER, don't go to the hospital if you are not going to already. If you're having trouble breathing, if you need hospital care, call your doctor and then go to the hospital. But otherwise, stay at home and recover. Now, my fear is that even if we have a moderate outbreak here in the U.S., we're going to need something like 200,000 intensive care beds. The U.S. only has 100,000 intensive care beds at any point in time. So we could easily overwhelm the healthcare system. So don't go to the hospital unless you're really ill. And we have to try to reduce the rate of infection so that hopefully we can spread it out and not overwhelm the system all at the same time. And we can even delay it long enough until we can have a vaccine or treatment, which we don't have right now.
Wow. Dr. Leana Wen, thank you so much for being on the show with us this morning. We'll see you soon.